Memorial Day weekend was a significant catalyst that caused continued exponential growth of our COVID pandemic here in the state of Arizona. We also have lots of non-COVID patients, and those are also listed on our forecasting tool. We know that a lot of people need healthcare, not just those with COVID. We have people who are coming from other respiratory illnesses that are also circulating within our communities, and all of that creates additional people who need our care in our emergency departments, in our surgical suites, and in our hospital. Also, our staff live out there. They live with you in the community, and they also get ill. They get ill at about the same rate that the community levels of COVID. That places additional burden on the healthcare system when our significant team members and employees who are here to take care of you are getting ill in the community. Criteria that we track throughout this pandemic and what's happening out in our community. The increase in cases have caused us to have to take some aggressive action. Difficult. Those are difficult for patients. They're difficult for patients. Difficult for our staff as well. Evaluating elective surgeries. Our goal is to take care of you, all of you in the community that need us, whether you're a COVID or a non-COVID patient, whether you have an essential surgery that's required or not. Our goal is to take care of all of you, so we're asking for your help for continued mitigation efforts. On the next graphic that we will share with you as well is what Banner is doing. So we all talk about, well, what is going to be the most rate-limiting step experience? The most rate-limiting step that we're going to experience will not be beds. We do not forecast that it will be ventilators. We do not forecast. We have been accumulating pharmaceutical supplies, beds, and ventilators since the surge in the summer, and we believe that we are prepared. What we will have is staff. Our staff are so incredibly skilled and knowledgeable to take care of you. You, if you are a COVID patient, you, if you are a non-COVID patient, and yet we know that we're going to need many of to making sure that the right staff member is there to take care of the right patient. This pictorial shows many of the different work streams to make sure that we have appropriate staff available for you. I'm going to go over a couple of statistics to show you where we are. We have secured over 1,000 staff members from out of state who will be coming to help us work the surge and the winter season. We secure staff out of state every winter, and we secured staff from out of state for the summer surge. 934 of those staff members have either already started this month or will start before the end of November. 900 more. 106 of those staff started yesterday. 220 more will be starting on Monday. To give you a point of reference, this is what is happening across the United States. The entire country is surging at the same time. This is significantly different than what Arizona experienced in the summer. In a normal winter of surge, there might be 14,000 positions posted to secure external labor. Last week, there were 20,000 positions posted. This paints a picture of the entire country looking for the same staff that every single healthcare system and every state in the country, including Banner Health, other work streams that we are addressing to make the most of the staff that we have and to find more staff to supplement that. We will be doing some deployment of corporate members from Banner Health to go assist out in the field, and we will continue with. We will look at every possibility of how we can supplement staff to be there for you at the bedside if and when you need us. On the positive side, I do want to go over a couple of things related to vaccine and treatment because there have been a number of movements over the last week. First of all, the Eli Lilly monoclonal antibody bamlanivimab became approved by the EUA through the FDA. It is available in limited supplies. Every single healthcare system that qualifies to receive this drug is doing so on a limited supply. We cannot go out and buy it on our own, but as we get supply, we are making it available to those individuals who meet criteria. This particular medication is not for hospitalized patients, but is for patients who have mild to moderate disease who fit strict criteria. We have several infusion sites within our Banner Health network that we are being able to provide this. If you have COVID, you can visit a Banner Urgent Care or a Banner Health clinic to receive additional information about if you might qualify and how we can go about trying to secure you an appointment if you do indeed qualify. Patients who are over the age of 18 are qualifying, and additional medical comorbidities are necessary as well. In addition to that, Regeneron emergency use authorization from the FDA. Banner will communicate out to the broader communities when and if we become a recipient of that drug. At this time, we have not received any information how or when we might receive drug. Similar to the Eli Lilly monoclonal antibody, we will communicate, we will likely have criteria, and we would expect that the drug will be in limited supply. Our pharmacy team continues to evaluate treatments and is evaluating the new combination treatment of the arthritis medication and remdesivir that also received some approval, and we will be providing additional treatment. In addition to that, let's talk a little bit about vaccine. As so many of us refer to, vaccine is the beginning of the end of this pandemic. And yet I do want to caution that despite all of the great and positive news that we are receiving about vaccine, that is going to make a significant impact into 2021. It is not something that is going to change our trajectory or our surge curve in December of 2020. So we're going to continue to ask everybody to pay particular attention to the mitigation activities that will help us flatten the curve while still remaining positive that vaccine is on its way. Here are a few things that Banner Health is currently doing to be ready for vaccine. We are committed to work with our states and our counties to be a distributor of vaccine where it makes sense. We expect to have 3 sites within the state of Arizona in December ready to go if and when we receive vaccine. We continue to prepare and identify individuals who will be the highest priority. Those will be healthcare workers and first responders, and we are working very closely with our counties and our states to make sure that we're able to do that. We also are preparing to safely handle the vaccine. As so many of you know, this particular vaccine, the Pfizer vaccine that is coming out first, and we are preparing to be ready for that. We also are preparing to both document the administration of that vaccine, as well as to provide reminders to those individuals when it's time for their second dose. We remain committed to be ready by mid-December if vaccine comes our way by then, and we remain committed to continue to work with the state and the counties where we are to make sure that we're ready and available to receive vaccine. In addition to that, I do want to provide an update of the state fairgrounds in Arizona, which is a place that we are providing COVID testing, as well as a place that we have also provided influenza vaccination. We expect to use that place for COVID-19 vaccination. Fairgrounds has been busy, a 32.4% increase from the week of November 9th to November 16th. We are also providing flu vaccines there, and we feel like we will be prepared to provide COVID-19 vaccine when the time comes. As a final reminder of my opening comments here, I want to wish everybody a happy Thanksgiving and remind you all about CDC guidance. For those in Arizona, if you reflect back to the summer, what happened after Memorial Day weekend really catalyzed a significant surge and curve of COVID-19. Thanksgiving is a 4-day holiday and is right around the corner. And as difficult as it is, as difficult as the year 2020 has been, we need all of you, we need all of us to follow CDC guidance. The safest place for everybody during Thanksgiving is at home with your family and friends that you live with. Every time you go outside of that curve, every time you invite one other person, one other family into that, you are increasing your risk. If you are going to have a gathering, we ask that it be as small as possible. If you are going to have a gathering, we ask that it be as short as possible. Being gathered together for 8 hours versus 2 hours increases risk. Please also, if you're going to have a gathering, gather outside. Better ventilation reduces the spread of COVID. In addition to that, if you're sick, stay home. Please wear a mask except when you're eating and drinking, and of course, wash your hands frequently. Whenever possible, stay 6 feet away from another individual, and those are great tips for all of us to follow during Thanksgiving. We have a big curve ahead of us, and if we can all do our part with this significant holiday upcoming, we can help flatten that curve and keep our hospitals, our clinics, our urgent cares, our emergency departments up and running for you if you need us for COVID or non-COVID illness or disease. And with that, that ends my opening comments, and I'm now available to take questions. Thank you.
Okay, thank you, Dr. Bessel. At this time, we are going to read the questions that were submitted from reporters in attendance so that Dr. Bessel can answer them. The first question is from John at Colorado Public Radio, and he asks, what exactly does it mean when a hospital hits capacity, and what would you do if you absolutely run out of room?
Thank you for that question. So there are different levels of capacity. We often talk about, in normal times, 100% of licensed bed capacity. What we know that we have to prepare for, and we are prepared for, is going above that. We are working with each of our states in regards to our surge plans. Most states are requiring for us to be able to show that we have a plan and are able to get to 125% of our licensed beds. As I've spoken about previously, our space, our beds, our PPE, our supplies, our equipment are not likely going to be a rate limiting issue for us. It will be our staff. Our staff get ill when they're out in the community, and our staff are using different models of care to surge and stretch to be able to reach into that 125% licensed bed capacity so that we can care for those that need us in our communities. We're utilizing a number of different ways to make sure that we have staff available, including external labor that I spoke about, upskilling of individuals, and redeployment of other type of staff to be out there in the wards, in the patient rooms, on the floors as helping hands. Thank you for that question.
Okay, the next question is from Katie at 9 News in Colorado. She asks, Weld County says they will not enforce public health orders that ask to close indoor dining. What is your message to those officials?
So we continue at Banner Health to work as closely as we can with our different counties and state governmental agencies, especially the Department of Health. As we do that, we know that mitigation works, and it's also a combination of governmental intervention as well as personal accountability. If you live in a county or a state that is having significant spread of COVID-19, we also ask you to take personal accountability to do the things that we've been talking about for months to help reduce the spread. We continue to work with those county individuals, discussing mitigation activities, as well as keeping them apprised of what the reality and the status is of our hospitals. At some point, if we reach a surge above the 125% or more of our staff become ill, we will have ongoing conversations to ask for other mitigation to assist us in being able to make sure that we can meet the community needs.
Okay, the next question is from Mike at ABC 15 here in Phoenix. Have any Banner hospitals hit ICU capacity, and how close are you to activating the surge plan or postponing elective surgeries?
So at this time, we have ICU capacity to care for both COVID patients as well as non-COVID patients. I would refer back to one of the slides that I referenced during my opening comments that has a yellow bar and a gray bar indicating COVID patients and non-COVID patients. As we continue to reach the surge levels and continue to respond, we will do everything that we can to make sure that we have staff available. Becky, could you please repeat the second and third part of that question?
Sure. So the rest of the question was, how close are you to activating the surge plan and postponing elective surgeries?
So we have plans in place already to help augment staff. As I alluded to previously, our staff live out in the community with all of you, and they get sick at about the same levels as all of you do. So part of our surge plan includes the external contracted labor, upskilling, redeployment. We are utilizing many different parts of our surge plan already to meet demand. As far as elective surgeries, I also have that on one of the slides in my opening comments that we're going to make available to you. At this time, we have not had a widespread decision on that. We are asking each one of our hospitals in the communities where they are to make a day-by-day and week-by-week decision. As we've stated previously, our goal is to take care of you, your family, and your friends. Our goal is to take care of you if you unfortunately get COVID and need to be hospitalized. Our goal is also to take care of you if you're a non-COVID patient, whether you have a medical illness or a surgical need. What we know from last time is that canceling surgeries has effect on lots of people. We do not do plastic surgeries in our hospitals. We do medically necessary surgeries. We do essential surgeries. And while at times there are patients who can maybe wait a week or 2 weeks or maybe even a month for their surgery, they cannot wait forever. They cannot wait for a prolonged period of time because they need those surgeries. Our goal is to continue to do surgeries for as long as we possibly can because those patients need us also.
Okay, the next question is from Cameron at ABC 15 here in Phoenix. Can you please describe how Banner plans to assist in the rollout of the coronavirus vaccine? How will employees get vaccinated and how soon will that begin? Will your employees be vaccinated on-site or off-site?
Thank you. So certainly a lot of positive activity around vaccine. We have been working very closely with the counties and the states where we provide care to be ready to receive vaccine. Specifically in the state of Arizona, we are ready to deliver vaccine to the top tier of prioritized individuals, which will be healthcare workers and first responders in the month of December. As I believe we all are aware, Pfizer filed for their EUA to the FDA, and we are waiting for that to become approved and for the CDC to offer their approval. We believe that the earliest possible date that we would receive vaccine would be the week of December 14th. So we are ready to go if we were able to receive that vaccine as early as that. The number of sites where vaccine will be distributed to those first individuals, healthcare workers, and first responders is limited. We will have limited sites. At this time, we expect to be in 3 different sites in the state of Arizona as an example, and would expect that most healthcare workers will have to go off-site to receive vaccine. Our goal is to make it as quick and as seamless as possible. And remember that all of those individuals will need to come back for a second dose 28 days later.
Okay, the next question is from Craig. He's at K-Gun TV in Tucson. Please describe capabilities at Banner's facilities in Tucson, capacities at Banner facilities in Tucson and elsewhere in Southern Arizona. How many vacancies exist in ICUs, and what are you doing to keep adequate staff?
Thank you for that question. So Tucson specifically is certainly having quite a large number of individuals in their hospitals, both COVID and non-COVID, that are causing some capacity issues for us down there. Also working collaboratively within that county, all types of interventions that we can to help flatten the curve. As you may be aware, Pima County put in a voluntary curfew that just went live this week and was announced this week, asking for everybody to voluntarily curfew between the hours of 10 and 5 to try and help flatten the curve. As far as the specific numbers for Tucson, we can go ahead and pull those for you after the press conference and provide them to you.
Okay, this is from Max at 3TV CBS 5 in the Phoenix market. There's a few questions, so I'll break this up for you. What are the biggest challenges when it comes to COVID-19 vaccinations? Are you concerned about anti-vaccination disinformation?
So a number of issues, of course, related to COVID-19 vaccine are at play. First of all, we don't have a vaccine yet, and we're still waiting. Second of all, even as we start to receive vaccine, and it certainly seems like the Pfizer vaccine will be the first to come, it is going to be in limited supplies. Hence the need to have a prioritized tiering approach to vaccinating the country. The first tier, as I've spoken about before, working collaboratively with our county and state, will be healthcare workers and first responders. Because there will not be enough vaccine for those that will want it, those that do not want a vaccine will really play a fairly limited role in the initial rollout of vaccine. Once we get more vaccine, once we have more companies that are able to provide vaccine besides Pfizer, those are issues that we will deal with later into 2021. At the beginning, we look forward to receiving vaccine. Certainly all of the data that is being shared with us shows that the Pfizer vaccine and those that are right on the tails of that from other manufacturers is both safe and effective. We look forward to learning more about those vaccines, communicating that both to our healthcare workers and first responders, as well as to the public at large, as vaccine does start to create the beginning of the end of this pandemic. And into 2021, we look forward to more vaccine distribution and continued flattening of the curve and the spread of COVID-19 in our communities.
Okay, another question from Max at 3TV CBS 5. He did ask about elective surgeries, which you've already addressed, so I'm going to skip over that question and ask the question that he posed last, which is, would there ever be a situation where COVID positive nurses and doctors be allowed to continue to work if they were asymptomatic?
Yes, the short answer to that question is yes. Individuals who are COVID positive and are asymptomatic might work. We know this from experience that has been happening in other parts of the world, specifically in other places outside of the United States, where they have had significant staffing constraints during a significant surge and have had to resort to that type of staffing model. That would certainly be something that we would try to avoid, if at all possible, but something that we recognize may have to come into play if the numbers continue to increase, as I have shared, and if our staff continue to get ill because they're living in the communities, and if we are restrained from getting adequate and appropriate numbers of staff. It would be one of our last types of maneuvers that we would undertake, but it is something that we are aware of, that we will do if we need to at the appropriate time, and would hope that we do not get to that point. So again, I'm asking everybody, as you think about your Thanksgiving plans, please follow CDC decisions as this question just posed.
Okay, the next question is from Eric at KV. Asks, have any Banner facilities hit capacity? How many ICU beds are currently available?
Across all Banner Health was at 64%, so we still do have ICU capability.
Okay, the question up next is from Ray at KUNC. Does your forecasting model take anticipated holiday gatherings into account?
Our forecasting model is built on a couple of premises, including previous winter activity, current mitigation HME as a forecasting tool. We have within our grasp an ability to bend and flatten that curve. So if we could do additional mitigation, holidays do not actually cause increase of numbers, we can actually make that curve be better. However, if we start to stray away from current mitigation, the curve can and will get worse. So but be mindful that Thanksgiving in 2021 will be a completely different scenario, and we can make it be a good scenario for all of us in 2021 by flattening the curve, following mitigation, and reducing the likelihood that you're going to infect family and friends, some of whom then require hospitalization, and unfortunately, some of whom may die from this terrible disease.
Okay, our next question is from Hunter at 12 News here in Phoenix. As of yesterday, ICU beds were at 90% capacity and inpatient beds were at 87% capacity. We've received a lot of claims from viewers that this is ordinary capacity amounts during the winter months, viral respiratory season. So my question is, what were the capacity percentages that hospitals and ICUs saw during this season in past years?
Thank you for that question, and we can get a specific statistic for you after today's press conference. But yes, in winter, we often run very high capacity, similar to numbers that you are quoting in your question. But remember, during those types of seasons. A lot of that is out-of-state visitors. A lot of that is non-COVID types of patients. What we are experiencing right now is a surge of a disease that's also infecting our staff because they live out there in the community. So while these numbers might be numbers that we have experienced previously, some of that is being fed by a disease that is different than what we've taken care of in past winters. Some additional commentary on that, I think we've spoken about this previously, is that individuals who have COVID that are in our hospitals are very sick. They take a lot of staff to take care of them, and this adds extra load on the per patient that we're caring for in our hospitals. In addition to that, because of the patients that are COVID positive, as well as just because of the spread that is in our community, our staff are having to wear additional PPE. This makes their job much more difficult. It makes them less efficient in being able to provide care. And it's all of these factors that add up to a significant stress that our healthcare system is experiencing as we care for COVID patients going into the surge.
Okay, the next question is from Matt at Fox 10. When you say you're going to hit 125% capacity, what does that mean in terms of care? Do some people not get it? Are people turned away? How do you manage this with staff?
So as we spoke about for our forecasting model, again, which is based on previous winter activity, current trends, and the IHME model, getting to 125% capacity happening here in the next month will cause quite a bit of stress on our healthcare system. However, we have a lot of plans in place to be able to meet that demand, but it is going to be stressful on our healthcare system, and we won't be the only one. I'm sure that we're all reading about what's happening in other states who are having a surge before the state of Arizona, and you know that the stress on the healthcare system can be significant. At this time and at 125% capacity, we do not forecast that we would need to be doing any triaging. So triaging is what I believe your question was about, of would we have to limit in some way care that's being provided to individuals. Other than potentially having to take some steps of elective surgeries and trying to delay them to create some capacity, we do not forecast that when we're at 125% capacity that we would be in a triage situation.
Okay, John from Colorado Public Radio asks, please define upskilling, and if hospitals fill up enough, would it mean that an ICU and or COVID patient could be cared for by a provider who doesn't have the skills experience they normally would? In other words, would the care not be of the quality one might normally expect?
So upskilling is something that we did in the summer surge and something that we are preparing to do and will do in the winter surge. What it means is taking individuals, to your question, who maybe do not normally work in the ICU and provide them additional training and knowledge so that they can help out in the ICU. They do this in a different type of model of care where they will also have other individuals who normally work in the ICU helping them to make sure that we're taking excellent care of our patients. I hope that answers the question that you had.
Okay, next question is from Griselda at KTAR News. What exactly will those 3 vaccine distribution sites be in Arizona? Who will be eligible for the vaccine?
So we continue to work very closely with our counties and with the state on identifying sites. At this time, we do have some tentative sites, but because we haven't received vaccine yet, those are not actually solidified. We will be doing prioritization, again, working very collaboratively with the county and the state of who will receive vaccine first. We expect that vaccine will be in significant numbers that we can reach the Tier 1A. Those will include healthcare workers and first responders.
Okay, the next question is from Joanna at KOLD, who also asked about the cities, counties where those vaccines would be made available. So we'll skip that question and go to Craig from KGUN TV in Tucson, who asks, please elaborate on specific arrangements for Tucson area for vaccine and treatments like monoclonal antibodies.
So we are working collaboratively with Pima County to make ourselves available to distribute vaccine. Again, we have not received vaccine, and so solidifying that exact location is still under discussion, but we expect that we will be a distribution site, assuming that we get adequate vaccine. As far as the Eli Lilly monoclonal antibody, we have received drug and we are working on plans to be able to distribute that in Tucson. If you're an individual testing COVID positive, I would ask that you contact your healthcare provider or urgent care if you've not yet been diagnosed, and they can provide some additional information. We do expect to be able to infuse that fairly quickly. We were able to stand up sites here in the Phoenix area within a number of days.
Okay, the next question is from Ray at KUNC, who asks, can you talk about the specifics of how you would prioritize patients to receive care should it come to that?
So if we were to get into a situation where we needed to do triaging, we would be operating under crisis standards of care. In the states where Banner Health operates, those have been stood up in Arizona and Nevada. As far as triaging, we did not do that during the previous surges, and we have not done that to date. There are very specific criteria that are followed and laid out, a very specific process that are also laid out that Banner Health would follow. We would be working very collaboratively with our other healthcare systems, our state and county, to make sure that if we got to that situation, we would be doing it in the most equitable and fair fashion possible. Again, we would all like to never get there. So please, as you're thinking about Thanksgiving, as you're thinking about mitigation, I ask you to take personal accountability. Every single additional risk that any of us takes puts the surge and the likelihood of having to get to those levels that much closer, and none of us want to get to those levels.
Okay, the next question is from Bram at 12 News, who asks, has the surge line been activated? Are you moving patients between hospital systems for care? And has crisis standards of care been activated?
So the surge line in the state of Arizona has been activated. It has been up and running throughout. It is active in that it is moving patients amongst different healthcare systems to load balance across the entire state. We expect that it will continue to be activated throughout the rest of the pandemic, and Banner Health is very much actively participating in that. As far as crisis standard of care, I'll refer to my answer previously. Crisis standards of care have been activated in Arizona and Nevada.
Okay, the next question is from Kayla at Cronkite News, who asks, you mentioned a number of approved COVID patients, a number of approved COVID treatments. For those who qualify for those treatments, are the treatments covered by insurance and or Medicaid, or are people paying out of pocket for those treatments? Are they cost prohibitive for the average citizen?
Can I go back? I'm going to go back and just augment my answer previously about crisis standards of care. So when I say that crisis standards of care has been activated, I mean that they have been put in place to potentially be able to be utilized by healthcare systems if needed. So I just wanted to augment that answer from previous. Becky, could you please repeat the current question?
Yes, so the current question is from Kayla at Cronkite News. You mentioned a number of approved COVID treatments. For those who qualify for those treatments, are they covered by insurance and or Medicaid, or are people having to pay out of pocket for those? Are the treatments cost prohibitive for the average citizen?
Thank you for that question. So currently those treatments are being covered by insurance payers. And so we will bill your insurance company if you come to see us, and we'll work through that process of getting reimbursed. As far as what each individual may have as an out-of-pocket expense, we'll ask all of you, if you have that question, to work with your provider, or if you come to one of our care sites, we can take a look at your personal situation and your personal insurance and answer that question in more detail for you.
Okay, the next question is from Craig at Kagon in Tucson. How do you ensure quality and competence in the outside workers you bring in?
So when we do redeployment of individuals or upskilling of individuals to help supplement staffing that we need in our hospitals, we go through training to make sure that those individuals are currently knowledgeable and competent to be able to lend additional helping hands for those nurses, therapists, and other physician staff that are at the bedside. We do that fairly rapidly in order to make sure that we have appropriate staffing, but we also have those individuals work with other individuals who are more normally assigned to those units. So whether it's an ICU or a med surg unit, they will be working with other individuals who are there to also help them as they provide those helping hands. I want to say a big thank you to all of those individuals who have volunteered to do that. I know that the staff on the front line appreciate those helping hands, and I hope that all of you that are out there appreciate that everybody here at Banner Health is doing their absolute best to try and meet the needs that the community has during the COVID surge.
Okay, the next question is from Melanie at the Hurdle Report. How frequently are staff being tested? How are staff supported when they need to take the time to self-quarantine following diagnosis or demonstration of symptoms? And what does a staff member's week look like? How many hours are they working on average?
So I'll take them one at a time. So staff are being tested when the situation is appropriate. And by that, I mean, if an individual is symptomatic, we of course will help them get tested. If a situation has emerged where there is a outbreak of COVID in a particular unit, we will go ahead and have them tested. If individuals are working in a long-term care facility, we test according to regulations. So we do all of that. For individuals that become ill, we have appropriate HR policies to make sure that they have an ability to do what is needed so that they can recover from their illness and come back to work, and we follow appropriate processes for that. We've been committed throughout to following CDC guidance throughout. Could you restate the third part of the question?
Sure. The third part of the question was, how does the staff member's week look like? How many hours are they working on average?
So at this particular time, we do have staff kind of throughout Banner Health that are working extra shifts, overtime shifts, et cetera. Do not have a particular number that I can share with you at this time. That's something that we can try and find after the press conference. I do want to say thank you to all of those individuals who are working overtime. Again, as we go into Thanksgiving, and as many of you out there may have time off, may be enjoying Thanksgiving, I ask for you to really consider making sure you do appropriate mitigation. There will be many, many individuals working in our hospitals, our EDs, our urgent cares, who will not be at home for Thanksgiving with their family. They're here to take care of you and the communities that we serve.
Okay, the next question is from Seth at Denver Gazette. Can you speak specifically to the staffing and capacity situations within Colorado facilities?
Yes, so let me just go back to my notes here for just a second. And in northern Colorado this morning, at individuals who were in enhanced precautions, 8 individuals who were in enhanced precautions in the ED, 67 individuals that were COVID positive in the inpatient or observation unit, and 14 individuals that were confirmed COVID positive, and 25 that were enhanced precautions and were on ventilators. The staff that work in the northern Colorado area continue to assess on a day-by-day shift staff that are there throughout this holiday season. In addition to that, we help provide ongoing support to make sure that they have appropriate supplies and equipment, as I spoke about previously.
Okay, the next question is from David from Maryvale News. How do you accommodate people needing beds when you have more patients than beds?
So I'll answer that question in this way because that's a fairly broad question. We continue surge plan. As I stated previously, supplies, equipment, ventilators, actual bed capacity, we believe that we will be able to meet the ongoing demand. Our biggest rate limiting issue is staff. Make sure we have the staff that are safe and ready to take care of you to do your mitigation activities. Our staff live with you. They live out there in the community. Our healthcare workers who go home, go grocery shopping, are out in your community, of them becoming ill and not being able to come to work also increases. So please think about that as you make your Thanksgiving Day plans for this week.
Okay, the next question is from Stephanie at the Arizona Republic. Are you still taking COVID-19 patients from other states like New Mexico?
So at this time, we have New Mexico who are COVID positive. We are So we are following all federal